Hello, hi, I'm Frankie Chambers and I will be performing vital signs for BSN 206. So I'm going to start off with my equipment check. So right here I have my blood pressure cuff with my sphygmometer, my stethoscope, pen and paper so I can document my findings. I have hand sanitizer for hand washing. And also I have alcohol wipes, which I will clean the stethoscope with for sanitation. So I'm going to start by using the hand sanitizer, washing my hands. I'm going to disinfect my stethoscope, the earlobes. I'm going to knock on the resident's door, introduce myself, and explain the procedure. So let's begin. Hello, hi, I'm your nurse, Frankie. Can you give me your name, full name, and date of birth?
Ray Torres, August 24, 1989.
I've stated two identifiers. He stated his first name, last name, and he gave me his date of birth. I'm here to take your vital signs. I'll be doing your pulse, respiration, and blood pressure. Are you okay with that?
Yes.
Perfect. So, first thing I'm going to do is check his pulse. And I'm going to give you the stats for the pulse. So, pulse normal range would be 60 over 100. That would be considered a normal range. Anything over 100 will be considered irregular. Anything under 60 will consider irregular. So I start first by palpating his radial pulse, which is located here. I will count that for 30 seconds and times it by 2. And I have my second hand watch that I can count the seconds. So anything that is below 60 is considered irregular. Anything above 100 is considered irregular. Again, I will palpate the radial pulse, and then I will count the beats per second to complete 30 seconds and times it by 2. So So I counted 33, so we would times that for 2, that gives me 66. So go ahead. Write down what I've put, 66. That would be his pulse. Next, I'm going to go ahead and assess his respirations. So when assessing his respirations, I want to see his chest rise and fall. That will be considered one whole respiration. So when accounting for respirations, I want to count them for a complete 30 seconds. And then I want to times that by 2. So, and also normal range for respirations would be considered 12 to 20 as a normal range. So again, I'm going to check for his respirations, and I'm going to look for the cues, the rise and fall of his chest. Okay, so I got 16, which he's in normal range. So next I want to document that on my notepad. Next, I will be taking his blood pressure. So when taking his blood pressure, I will be using my stethoscope, blood pressure cuff, normal size, sphygmometer. So for doing the blood pressure, I want to locate his brachial pulse. But first, let me give you a few ranges on blood pressure. So 120 over 60 would be considered normal range. Within that range, anything that's lower or higher is considered altered. So first, I want to make sure his hands and palm is at facing down, is at normal heart rate. I also want to make sure his legs are planted flat and not crossed. Thank you. And I want to ask the patient, do you know your baseline for your blood pressure?
No.
So no, he doesn't know his baseline. So I'm going to estimate the blood pressure to be at 120. So when inflating it, I want to add 20 millimeters of mercury to that 120. So I would inflate it to 150. Okay. So when I have located the brachial pulse, which the brachial artery, which will be here, there's a section here, I want to palpate it. And once I've identified it, I want to place the cuff, which I'm using his left arm, I want to place these arrows, and I want to place the cuff itself 2 inches above that point range. Making sure I can see the sphygmometer for his reading. I want to wipe down the earlobe part right here with alcohol wipes. Place the diaphragm on the area where I located the brachial pulse. And I want to pump this all the way to 150. And I'm looking for the systolic, and that's the crook-cuff sound, the first one that I hear. And then the next one will be his diastolic, which will be the bottom number. So he has 120 over 70 is his pulse. Systolic is at 120. Diastolic is at 70. He's still considered to be in normal range. So that completes my assessment. The blood pressure was taken, so now I'm going to ask the patient if he has any concerns or anything else that he might want to ask me while I'm here, and then I will go ahead and document his findings into the electronic documentation record system. Do you have any other concerns that you might need a question or answer?
No.
Okay, then that concludes this vital sign session.